Hello, everyone. Thank you so much for joining us for today's Benefits Buzz, the Physical and Mental Health Connection. Before we begin, please note this event will be recorded and we will share the recording in a follow-up email sometime early next week. I am pleased to pass it over to Elena Gambon, Chief Strategy Officer and Chief Growth Officer here at First Stop Health. Elena, you want to take it away?
Absolutely. Hi, everybody. Happy Thursday. Good to be with you all again. Today's conversation is around how physical and mental health are very, very linked. And we are going to start today with a quote, which is new for us. If you'll flip to the next slide, from a professor at Ohio State. He's actually the head of the psychiatry department. And I like this quote and I chose it because I think it perfectly explains what we want to talk about today. And it says, when mental health is ultimately recognized as essential to physical health, not as an extraneous element of it, then we will have access to true, complete modern medicine. And the reason I like this quote really is for that word essential, which is mental health is not just a part of physical health. It doesn't just implicate physical health. Physical health doesn't just implicate mental health. It is an essential part of physical health. The two are inexorably linked. And in order to hammer this point home before we talk about in solving for it, we have some data. 1 in 3 patients have a mental health condition in the United States. That probably feels like a lot higher than 1 in 3 if we look at our populations and we look at ourselves. 50% of adults will be diagnosed with a mental illness in their lifetime, and yet 3 in 5 people with a mental illness will receive no treatment. I've spent a lot of time talking to our clients and brokers about how mental health over the last really 10 years has transitioned from this concept as mental illness versus no mental illness or individual problem to a spectrum and a community-based solution. So no longer are we thinking about mental health as a disease state. It's an ongoing relationship around prevention as much as it is treatment. And when you think about mental health that way, you solve for this very real problem that mental health causes physical health issues and physical health causes mental health issues. Patients are 3 times more likely to develop a mental illness if a chronic disease already is present. And the opposite is also true. Comorbidities within a population increase the more mental health issues there are. So that is something that we want to address as a virtual care solution that serves both the physical and mental health spectrum. Now, as you all know, First Stop Health provides virtual primary care, virtual urgent care, and virtual mental health. 1/1 of 2025, we are rolling out a new enhanced whole mental health product that aims to solve for the very topic that we are discussing today. Whole mental health is designed to do more for a patient. It, in effect, has 3 components. Number 1 is we've introduced this concept of coaching. Now, if you're not familiar with coaching, you might be wondering, how is coaching different from counseling? Well, it is. Coaching is goal-based support from coaches who are trained and certified in behavior change for things that really straddle the line of physical and mental health. Think tobacco cessation. Think lifestyle and wellness goals. Think workplace stress. Think burnout. Think vision planning. Coaching is really meant to solve for the in-between. Maybe you are a patient or someone who you've not been diagnosed with depression. You do not have clinical anxiety. You don't need a medication, but you also need a little bit of help. That kind of intermediary space is where most of us sit. And so coaching is a fantastic option for that. The next thing that this program does is it adds, on top of our short-term individual counseling, we can now serve families and couples, and we do long-term counseling. So We are still supporting patients in the moment when they need us. We are still able to provide patients with quick, efficient, $0 access to counselors, psychologists, licensed clinical social workers. But now, if we have a patient that wants to see a counselor every Wednesday at 5 for the rest of the year, we can support that. This whole mental health product is designed to support everything short of active psychosis and inpatient rehabilitation need. We have specialists in post-traumatic stress disorder. We have specialists in eating disorders. We can now administer services at both a high and low acuity clinical level. And lastly, whole mental health allows for prescriptions. So historically, our clients have known that mental health sometimes needs pharmacotherapy. We have patients where their biology dictates the need. Levels of serotonin and dopamine can indicate and implicate anxiety, stress, and depression. And we need to be able to treat the physical components of mental health as well. So in whole mental health, patients will have access to a doctor if pharmacotherapy is needed. Think SSRIs and SNRIs, anti-anxiety and depression medication. And these medications are always non-controlled substances, but they are working in tandem with ongoing counseling to help heal and treat a patient. So we are still in the model of a $0 patient copay. Patients can talk to a human being in minutes and schedule with their provider within days. In the whole mental health product, patients can go on the app or online or call our number, take a look at the providers that are available to them, choose the one that they think is the best fit, and then stay with that provider for as long as they want to, always with the option to change so that they can find the best relationship for them. One of the most important things about this service on the next slide is how people access it. And simplicity is key here. We want to create a single stop, a first stop, if you will, for patients to get care. And the beauty of our whole mental health service, combined with primary care and urgent care, is that it offers a number of different entry points where we might capture a patient, because not everybody's ready to take the mental health leap. Some patients show up first in urgent care, 2 a.m. Kiddo has an ear infection. They don't know where to go, so they call First Stop Health. Some patients show up first at one of the on-site biometric screenings we do for their employer. Some patients show up first because they are proactively responding to a wellness incentive that we're managing for their employer. Some patients show up first in response to our outbound clinical outreach. And some patients do show up first in mental health. Regardless of where they start, it is our job to bring them into this single virtual medical home. And then if and when they need to use their in-network benefits for in-person care, steering them to the highest quality, lowest costing option available for a better quality clinical path. On top of that, we are working round the clock on outbound engagement campaigns to make sure that we are changing patients' attitude around healthcare. So on the next slide, you'll see 2 of the types of patients that we frequently engage. Our health-driven patients, which we've affectionately nicknamed primary care, and our health-avoidant patients, which we've affectionately nicknamed doctorless Dawn. Now, not every doctorless patient is a male-identifying individual, but that is a higher percentage. What we know about primary care, our health-driven patient, is that there is pretty consistent relationship with healthcare and a desire to engage, but the pain points involve a lack of convenience, a lack of certainty around process, a lack of time. And our goal is to reroute current behavior to First Stop Health, because we know that when a patient has access to $0 care with no fear of in-network or out-of-network repercussions, that will take care of both physical and mental health issues, and that spend time learning about the patient, we can help primary care do a little bit better than what she's experiencing today in a fragmented system. For our healthcare avoidant patients like Dr. Dawn, she are eliminating or avoiding care because of a lack of time, but also a lack of money and highly a lack of trust or internal motivation to make a change. And so it's our job to prompt new health-driven behavior for the same reasons I just described, using the science of behavior change. So when we're reaching out to patients, we are consistently focusing on custom, ongoing, persona-based reminders and messaging that meet people where they are. We're deploying behavioral science from the fog model and nudge theory to make sure that messages resonate. And we are making things personal. A father of two will get very different messaging from us than a single woman in her 30s because they use healthcare differently, and they should be spoken to in a way that resonates with them. So to sum up what we've talked about today, I want to share some statistics with you. What whole mental health has been able to achieve. Arguably, most importantly, our North Star is engagement. We are so excited that our mental health solution sees on average 28% utilization, which compared to a typical EAP is 5, sometimes 10 times what clients have experienced. When a patient engages in whole mental health, they report on average 45% of patients with better depression risk scores from the moment they started with us to a 12-month period after. 66% of patients report reduced alcohol and tobacco usage, fewer binge drinking episodes, fewer individual tobacco usage episodes, and higher sense of control. 55% of patients report better stress and risk scores around stress and burnout, and 74% of patients report higher sense of purpose. We get quotes all the time saying things like, my counselor was finally able to help me make sense. I talked to someone in 10 minutes and felt safer knowing that I had a plan. When someone is in the throes of a healthcare event, it can feel like they're drowning. And it is our job to show up reliably every time, quickly, and comfort that patient and get them on to the next step, especially when it comes to mental health and behavioral health concerns. So if you have any questions about what we're doing in this space or how we can serve your employees, I would be tremendously honored to talk to you more about it and spend a little bit of time one-on-one. Thank you so much for joining. I hope you all have a wonderful rest of your day.
Elena, thank you so much. Wonderful job as always. And thank you all for your time today. As Elena mentioned, please don't hesitate to reach out. You can reach us at marketing@fshealth.com, or you can contact your First Off Health representative. Thank you again for your time and have a wonderful rest of your day.